This will be a quick little overview of the terminology that applies to movements of the body and movements of synovial joints. This will be a supplement to what we talk about in lab and lecture, so that when we're talking about different muscles, you'll be able to explain precisely the movements that they bring about. If we're talking about angular movements, we're talking about motions that occur at the joint itself. We're not talking about gliding joints here. We're talking about a situation where we have two or more bones coming together and forming an angle. So for instance, the humerus is going to articulate with the ulna and the radius. If you decrease the angle between the forearm and the humerus, then what you're doing is you're flexing that joint. If you increase the angle, then you're extending that joint. So if you go to the gym and you pick up a pair of dumbbells and you're going to do curls, bicep curls, then as you pick up the weights and bring them closer to your body, you are flexing the elbow joint. As you drop the weights back down, you're extending that joint. Hyperextension is defined as extension beyond anatomical position. Now, unfortunately, it's also quite often defined as extension beyond the normal range of motion. So let's say, for instance, looking at the elbow again, that you can hyperextend your elbow. Imagine yourself in the anatomical position. That would mean that you can bend your forearm back. So you can straighten out your arm and then continue beyond a 180-degree angle. So that would be hyperextension in the definition that I'm using here, but it would also be hyperextension as it relates to the fact that most people can't do that. Finally, we have adduction and abduction. Ad means towards, ab means away from. So imagine that you stick your arm out straight and put it up high, and then you bring it down to the side of your body. That would be adduction at the shoulder because the arm is moving closer to the midline of the body. Abduction would be the opposite. That would be moving your arm away from your side. Let's look at some specific examples, and we'll start with the easy ones, the elbow and also the knee. They're easy because we don't have to consider anatomical position when we're discussing these joints. With the elbow, the angle that we're interested in is on the anterior surface of the arm, and if that angle gets smaller, that's flexion. If it gets larger, that's extension. And we can't extend beyond anatomical position. When we're talking about the knee, the angle we're interested in is the angle on the posterior of the leg. If it gets smaller, that's flexion. If it gets larger, that's extension, and we can't extend beyond anatomical position. Now let's look at some trickier joints, and we'll start with the hip. So in the hip, if you were to lift your foot in front of you, that would be flexion of the hip. Now let's say you've got your leg raised like that and you drop it back down. That would be extension. If you move it beyond anatomical position, so you lift your foot behind you, then that would be hyperextension. Now I should point out that if you're in a hyperextended situation and you move your leg back down, so you move it forward to be back in anatomical position, that is still flexion. So flexion refers to an anterior movement of the distal end of the limb in this case, whereas extension is a posterior movement. Now let's look at the hand, the wrist specifically. Imagine that this photograph was turned sideways so that we're thinking about a hand that's in the anatomical position. The arms are at the side, the palm is facing forward. Flexion is going to be anterior movement of the fingertips. Extension is going to be posterior movement, and if we extend beyond anatomical position, that's hyperextension. Finally, we have the shoulder, which is very much like the hip, except there is more movement here. With flexion, we're moving the hand forward, so we're moving it anteriorly. Extension, we're moving it posteriorly. And if we move it beyond anatomical position, so we have our hand behind us, then that's hyperextension. Note that when we're talking about movements of the vertebral column, we're quite often talking about motions that occur over several individual joints. And that's what you're seeing here. Here what you're seeing is a case of lateral flexion and lateral extension. When we're talking about lateral motion, we're referring to movement that occurs within the frontal plane. The angle that we're interested in is the midline of the body. So if I look at the guy on our right, we're looking at the midline here. I'm just going to draw it out roughly. And this is the angle that we're interested in, this angle here. So if that angle increases, that will be extension. So if he moves his head from that position back to the anatomical position, that will be extension. If he moves in the other direction, so let's say he starts in the anatomical position and he moves this way, that angle is going to get smaller, and that of course will be flexion, lateral flexion. And the same thing of course would be true for our other fellow here. And I'll try to draw the midline again. And we're talking about the angle that is the smaller one here. So the angle, again, we're talking about this angle here. Extension will bring us back to the anatomical position, whereas flexion is going to bring the body away from anatomical position. Places where you might observe abduction and adduction include the wrist, the digits, the shoulder, and the hip. And it would be helpful to take a bit of time and think about what these movements would look like. In fact, practice all of these motions on your own body. It's the best way to learn things. Move your limbs and digits around and try to describe the motions that you're producing. There's a special type of motion mentioned here known as circumduction. And this is where the distal end of a limb or appendage is going to be used to draw a circle. So you can see in the diagram here, we're looking at the shoulder joint, and a person is pointing out their hand and they are circumscribing a circle. And this requires a lot of different movements. We have abduction, flexion, extension, and adduction all occurring in the correct sequence to make that happen. There's one more motion here, and that's rotation. And this rotation that you're seeing in this diagram is the rotation of the humerus itself. And of course, the head of the humerus is going to rotate within the shoulder. But we'll come back to that one in more detail. Recall from Biology 111 that a condyloid or ellipsoid joint allows for free movement in two planes, but it does not allow for rotation. If you rotate your hand, that rotation is not actually occurring at the wrist. Instead, that motion is the result of your radius rotating and motion occurring at the elbow joint. When we're dealing with the hand, we want to be aware of anatomical position. If you are wiggling your hand side to side, it's adduction if it's towards the midline of the body, and it's abduction if it's away. The fingers are a special case. If you spread your fingers, that's abduction. You are moving your fingers away from each other, or you can think of it as moving them away from the midline of the hand, except for the middle one, of course. And if you're adducting them, you're moving the fingers back together. For ball and socket joints like the hip and the shoulder, abduction is the movement of the arm away from anatomical position, and adduction is towards anatomical position, towards the midline. Circumduction is not a single motion. So it's a special case where we're dealing with 4 motions that are being performed in the appropriate order: flexion, extension, adduction, and abduction. So this occurs at ball and socket joints like the hip and the shoulder, but it can also occur at the saddle and condyloid joints. So for instance, you can wiggle your fingers around in a circle. You can wiggle your thumb around in a circle. So remember that saddle and condyloid joints allow free motion in two planes, but they don't allow rotation. But of course, as you're doing that, your thumb isn't rotating. Even when you're drawing a circle with your arm, the humerus and the other bones of the arm are not twisting. They're not actually rotating. Rotation occurs when we have twisting of a bone at an articulation. So the bone is going to revolve around its own long axis. An example of this would be the atlantoaxial joint between the atlas and the axis, the first and second vertebrae of the neck. Recall that the axis can twist, it can rotate, and there's a little pen known as the dens or odontoid process that fits into a little groove on the atlas. At the shoulder joint, we can have twisting of the humerus. And also at the elbow joint, we can have twisting of the radius. So these are all examples of rotation because the bone is rotating along its longitudinal axis. You can rotate your femur a bit within the hip as well, although not all that much. Here we have an example of rotation occurring at the shoulder joint. So this woman here is keeping her elbow in a locked position. There's no movement occurring there. Instead, she is rotating the humerus within the socket at the shoulder. Imagine that we could put a point of reference onto the anterior surface of the shaft of the humerus. If that point of reference is moving away from the midline as she's rotating her humerus, then that means we're dealing with lateral rotation. If that point on the surface of the bone is moving medially as the humerus rotates, that would be medial rotation. The terms rotation, adduction, abduction, extension, flexion can be used to describe movements at most non-gliding synovial joints. However, just to make things a bit trickier, there are a few joints that have special movements and they have special names as a result. We have elevation and depression. We can use this in reference to movements of the scapula or of the jaw. We have protraction and retraction, which occurs mainly to the jaw, but it can be used to the joint between the sternum and the collarbone as well. You do actually have a little bit of movement there. We have inversion and eversion, which are special movements of the feet. We have pronation and supination, which are special movements of the hand. And we have opposition, which is a special movement of the digits. Let's start by taking a look at the movements of the jaw. These are pretty straightforward. We're talking about motion that occurs at the temporomandibular joint. That's the articulation between the temporal bone and the mandible. Elevating the jaw just means moving it upwards, moving it superiorly. So if you're going to bite on something. Depression is the opposite, you're opening the mouth. Protraction is when you stick your jaw out. So you are sticking your jaw anteriorly. And retraction is where you withdraw your chin. So you are withdrawing your jaw posteriorly. Your hands can be pronated or supinated. Imagine yourself in the anatomical position. Your palms, of course, are going to be facing anteriorly, and that is referred to as the supinated state for your hand. Now imagine starting in anatomical position, you just bend your elbows. You can bring your hand up so that the palm is facing superiorly. Your palms are facing upwards. That would still be referred to as the supinated state. The pronated state is the opposite. So imagine yourself in the anatomical position, but this time you've rotated your hands so that the palms face posteriorly. That would be the pronated state. If you were to bend your elbow in that state, your palms would be facing down towards the ground. They would be faced inferiorly, and that would still be considered the pronated state. And from that, you might be able to figure out where this term, pronated, comes from. Remember that when you're prone, your palms are also faced towards the ground. So pronation is the movement of the hand to the pronated state. Supination is the movement of the hand to the supinated state. It's a return to the anatomical condition. So starting on the left here, our left, we have an individual that's in the supinated state. They're in the anatomical position and their palm is faced forwards. Now they're going to rotate their palm so it faces backwards, and that brings them into the pronated state. So this would be pronation. Now if they go from that pronated state back to the supinated state, back to, in this case, the anatomical position, that would be supination. And notice that this is the result of a pivot within the elbow. So we have the radius twisting. The radius is rotating over top of the ulna. The hands are capable of some remarkably complex motions. So it's not surprising that we have a lot of special terminology to describe the motions of the fingers and the thumb. It can be rather tricky to figure out which terms you should be using. The key is to always think back to the anatomical position. So imagine that you have a person that has their hand up over their head and their arm is twisted and they're doing something weird with their thumb. And you want to figure out how to describe that motion of the thumb. Well, you have to picture them in the anatomical position doing the same thing. Abduction and adduction, when we're talking about the thumb and fingers, occurs within the frontal plane. And extension and flexion of the thumb and fingers occurs within the sagittal plane. And this is the same for the shoulder, by the way. So let's take a look at these examples. In the anatomical position, your palms are faced forward again, and your thumbs are lateral. If you stick your thumbs out more, make them more lateral, then that would be abduction with a B. You're moving your thumbs away from the midline of your body. If you bring the thumbs back towards the other fingers, you're bringing them towards the midline of the body, and that would be adduction with a D. Flexion refers to moving the thumb across the palm of the hand, so touching it to the palm, for instance. Extension of the thumb would be the opposite, moving it away from the palm. Opposition is a special type of flexion where you're touching your thumb to the tips of one of your fingers. So it could be any of the fingers. You could be making the OK sign, for instance. Reposition is where you go from opposition back to the anatomical position. And these terms do also apply to the fingers as well. If you curl your fingers and touch your palm, or curl your fingers into a fist, that would be flexion. If you straighten out your fingers, that would be extension. The hand, as I've mentioned, can do some pretty amazing things. These motions, especially motions like opposition, were one of the greatest feats of evolution in humans. It's what sets us apart. We don't and can't use the terms supinate and pronate with respect to the foot, and that's because those movements don't happen for the foot. The tibia and fibula are not going to rotate at the knee, or at least they shouldn't. We do have rotation at the ankle joint though. If you rotate your foot medially, that's known as inversion. So what you're doing is you're rotating the sole of the foot, the plantar surface, towards the midline. Imagine that you step in something and you need to look at the bottom of your shoe. Part of what you're doing there is inversion. That's one of the movements that's involved in that activity. Eversion is the opposite. So in this case, you're pointing the sole of your foot laterally. And finally, our last set of terms also refers to the foot. We're talking about the ankle joint here. Dorsiflexion is raising up the toes. So we are moving the top of the foot, the dorsum of the foot, upwards. And plantar flexion, we are moving the toes downwards. Again, though, I'm not talking about the motion of joints within the toes. This is happening at the ankle. So this would push you up onto the balls of your feet. Finally, here's the terminology. You should be able to explain these different terms and maybe even give examples of where this sort of motion might occur. So on your lab exam, for instance, I will ask you to identify certain muscles and tell me what kind of motions they bring about at what joint. And you should be able to use the proper terminology to do that.